Good afternoon. My name is Beth Harrington, and everyone else seems to have skipped town. Maybe they know something we don't know, but I will be chairing the meeting with Nicole's help. So I'd like to welcome everyone to the April meeting of the Health Planning Council. And Nicole had sent out the minutes of the March meeting. Did everyone have a chance to review them? Were there any additions, changes, corrections? If not, I would like a motion to approve.
I make a motion that the minutes be approved as distributed. Bill,
And is there a second to that? Thank you, Bill. Jan, second. All those in favor? Thank you all. So the minutes of the March meeting are approved as distributed, and we'll go on to updates and announcements, and we'll let Nicole go first.
Unmute myself. Hello, everyone. So I just wanted to give everyone an update as far as our role as ambassador to Care Compass Collaborative, the social care network for our region. We have concluded our official role as an ambassador last week with them. We submitted some capacity building plans and made some recommendations in order how to fill in some of those gaps and connected some people here them in hopes maybe that they will want to join the network. We are still in consideration of continuing to work in some capacity with them, but regardless, I think because of the nature of a human service coalition, as well as the Health Planning Council, that we will continue to make sure here in Tompkins County that those who are participating and not participating are making sure we're all working well together and know how to connect people to services. So that was my update as far as the ambassador role. And then I just wanted to remind everyone that we have our Compassion Corner meeting. So that's the monthly meeting for the direct service employees that work with community members. So that is this Thursday from 5:30 to 7. And if you want any more information, feel free to reach out to me, or you can find information on our website. And that's all I have for you guys today.
Thank you, Nicole. Next up is Alex Moore with the Community Health and Resources Network.
Everyone, good to see you all. Wanted to provide a quick update on the Community Health and Resource Network. I believe last time I presented was probably about a month ago. So the latest on the referral numbers from the healthcare providers, we've got about 472 referrals from healthcare providers to the social care hub. And then we excitingly have had one referral from CBO to CBO. So that felt like a really big milestone I wanted to share with you all. We've of course got folks who are still kind of getting up and running on the system, still kind of trying to understand how that's going to work within their own internal workflows. So I think that those are kind of the big updates for you all. We've got some additional design sessions scheduled over the course of the next few months. So we've got a new tech system that we'll be deploying kind of end of summer. And so there will be some cool new functionality for all of our users. So I will share more information as I have it. But that's the update. Any questions? All right. Thanks,
Thank
everyone.
you, Alex. I don't see Karen Brown on yet, so we will go to Liza from Lifelong.
Good morning, everybody. I did want to give an update for those of you that have been following along with the situation for the Library Place community room. We did come to an agreement last week with the prospective buyers of that space, and I just wanted to thank any of you or all of our community members that expressed a lot of support as we navigated, the possible impact of a change or a shortening of the time frame that we had available to use the Library Place community room. So we're very pleased with the outcome. And Lifelong will have long-term use of this space. Our original agreement was for 20 years. We still have an agreement for 20 years. And hopefully longer. So we're really making good use of that space, but I'm super pleased that that has moved forward. I did also want to just let folks know that Lifelong will be hiring a new HICAP or Medicare program coordinator for the county. It's a 20-hour-a-week position. So if there's anyone that you might know of who might be interested in this part-time position, I'd love to talk with them. Thanks.
Thanks, Liza. Karen, Bullis, could you talk about the Senior Expo?
Yeah, I sure can. So this year, our office, the Office for the Aging, is celebrating its 50th anniversary. And to commemorate that, July 25th, we are bringing back the Senior Living Expo. It's been a long time coming. We've done it every year in the past. For those of you that remember, the last time it was scheduled was in 2020 and COVID hit and we had to cancel it. So this is our first year of doing it. We're very excited. Again, it's Friday, July 25th from 2 to 5 at the Hotel Ithaca. We're going to have a bunch of vendors. Invites have already gone out to vendors. I'm getting a good response. If for whatever reason you think you would want to participate and you haven't received one, you can certainly reach out to me. Stay tuned for more of the public information to kind of get out closer to the time. We're going to have a breakout session that's hopefully, it's looking like it's going to be a little bit like a panel to discuss Medicare fraud, scams, elder abuse, that sort of thing. And then we're also going to hopefully be able to provide some free fall risk screenings done by Ann Riley. So we're excited to have that going on as well. Yeah, so that's exciting.
Congratulations on 50 years.
Thank you.
Is there anybody else attending that would like to make announcements? Jan, please.
I just wanted to give a quick update about the CDPAP change that most of you have probably heard of. I think I talked about it at this meeting. We have transitioned all of our consumers. I think there's just one we're having trouble with, not the consumer themselves, but the system. And also most of the aides. The first payroll was last week. Sorry, all I can say is it's been a terrible transition. PPL, which is who we're transitioning everyone to, the system goes down. They add new things after people are already enrolled. They say, oh, they also have to have this to be fully enrolled. It's just, I could write a book about all the things that have been difficult. So I just want to give a shout out to my staff who have worked so hard to make sure everyone is enrolled, because there's a lawsuit right now for people who didn't get enrolled by the April 1st deadline, and the judge has given them more time. So anyways, that's the update for what it's worth. A lot of complaining.
Thank you, Jan. I'm sure that the people that you're dealing with appreciate the support that you've been giving them. So thank you.
Sure thing.
I will update for the Slayville Fire Department. We have the respite program up and going. Bit by bit, we add 1 or 2 people. Interestingly enough, most all the people come from Ithaca area. So the goal of looking at the town of Caroline, we're still working on that, and that's tied into a social community dining program, and that's really taken off. And my thanks to FoodNet, Allie, and Jill, and all those people. We went from having 2 or 3 people till we had 14 people last year. And we've been told how much they enjoyed getting together and seeing people that they haven't seen before. So that social component is really critical. So we're really pleased with that. If there's no further announcements,
Absolutely. I do have.
Um,
But I missed in my announcements back. So first, Karen Brown is not here right now, so I did want to just mention that the next long-term care committee is scheduled for Friday, May 2nd at noon via Zoom, and there's going to be a highlight on the Alzheimer's Association. The community engagement manager will be attending and just talking more about what they offer residents in Tompkins County. So I will make sure to get a flyer out for that, so you have that information. I know our last conversation, we had our breakout groups and we talked about the, possible implications of federal cuts and policy changes and whatnot. So I do want to welcome people to keep us updated as time goes on, if there are any ongoing changes. One thing I do want to mention as something that we have seen since the last time we met is, unfortunately, our New York State Public Health Fellows, which we have one here today, Anushka is going to be presenting to us. That program has been cut prematurely by 13 months, right, Anushka? I believe it's 13 months, yep. So that is something that has been really vital in the last several years, especially I can speak to our community health improvement process. And the health fellows have really made a huge difference in the progress we've been able to make. I have spoken with Jeremy Porter, the interim deputy health commissioner, and Harmony Ayers Friedlander. And I do know that Jeremy's going to talk a little bit about at the Health and Human Service Committee meeting this month as well. Talk about the important work that they've accomplished and what that loss would look like and how maybe it might be able to be absorbed within the department. But I did want to let people know that was something that recently happened. So that's unfortunately my updates.
thanks. I'd like to introduce Travis Brooks, who's one of our legislators, and he chairs the Health and Human Services Committee, and he's going to give us an update on that and the goals. And we have time for questions and answers after his presentation. So thank you, Travis.
Absolutely. Good afternoon, everybody. Let me pull them back up. So for 2025, last month in March, we finalized our goals, and I'll share them with you in just 1 second, and then I'll take questions. So I'll just run through them, and then you all can feel free to ask questions. So the first one was to examine and determine steps moving forward with the Office of Human Rights. As some of you may know, Dr. Ken Clark retired back in December. And so there's been some conversations on what we are going to do with the department and how do we move that work forward. The county administrator and his team, along with Charlene, are going to present several different options with us after they've decided which are the best ways to do this. This will include community, people from the department, and some of the human rights commissioners. We're going to continue to help support the efforts of the county through diversity, equity, and inclusion, especially through the WDIC committee. One of the members brought forward that we should be looking at food insecurity issues. And so that is one of our priorities this year. Health equity, eligibility, and accessing services and benefits. We know that, especially with this current administration, that it is even more important to make services accessible at the Department of Social Services. What ways can we do that? How can we support making it easy on community members? I remember when I ran for office, there was a study done, and I believe it was 2018 or 19 numbers, that only 30% of folks in the county who are eligible for SNAP benefits actually receive them. That's a pretty staggering number. That means 70% aren't receiving their benefits. I don't think we'd ever get to a number of 100, but I can imagine a county where 70% of people are eligible are actually getting benefits, what that does for them and their families, and actually what it does for the local economy. The county is in the process of creating a homeless shelter and trying to figure out, along with the city, how do we address those needs? That's a huge priority for us. We have two big positions open. We have the commissioner of DSS and the commissioner of whole health. I believe both of them have been advertised. So over the next few months, we will be hiring for those two positions. Collaborate with nonprofits and peers to bring people to the table. One of the goals was to connect with Nicole and Health Planning Council to align work, to receive a report from the whole health department to discuss their strategic plan progress. They have come up with their strategic plan. We're going to hear from them. Actually, every department is invited over the next few months to share with the committee. But one of the ones that we are trying to look at, we're trying to figure out how we can do this work successfully, is to discuss mobile home park regulations, including data on water, sewer, and other topics, which the environmental health and staff monitor. And then we've already started having conversations on how to do this, but a big one is youth engagement, especially with preteens and teens. The goal would be to define opportunities for young people in the county, collaborate with schools and community to reach marginalized youth, define the barriers and try to help solve them with agencies and organizations that work with young folks, and really focus on transportation and try to get a better understanding of what that looks like, especially for rural youth. We know that people of lower incomes are getting pushed to the further outskirts of the county. We want to make sure they're able to take advantage of opportunities. We are working with Kate Shank's booth to put together a summit for organizations that work with preteens and teens. Hopefully over the next month, we'll have picked a date and sat down with people that from the community that work with this population to see if it's something they want to be involved in. So that's the broad overview of the goals. I am happy to take questions, if there is any.
Travis, I have one. In the Office of Human Rights, is it just an issue of filling that position, or are there other things you want to do with that department?
So it's not an issue yet of filling the position. It's before I got onto the legislature. Years ago, when Dr. Clark took over, it was determined by the previous director of that office that we didn't have the capacity to actually investigate complaints. And so the office was set up to do that, and they can't do it in its original design. And so there's been some conversation and questions about what is the office supposed to do outside of have a space for people to come in and file complaints. So instead of keep doing the same, we are trying to figure out what are the best possibilities and how do we help people who are marginalized? How do we continue to help people who need that support in the best way possible? So instead of acting like we're the experts, we want the people who are the experts to give us a few plans on how to move forward.
Thank you. That's a good explanation of it. Does anyone else have questions for Travis?
I do, Travis. Around the large amount of people that might be missing SNAP benefits that might be eligible, do you know if there's been like coordinated efforts to do some like outreach in terms of schools and food pantries? I would think that would be a prime places to get some of those people.
So one of the first steps is to figure out what exactly by law the Department of Social Services is allowed to do. So we've gotten different interpretations. And when I first got on the legislature, we were told that they kind of weren't allowed to advertise. I don't know what that means and what that looks like. And that's what I'm hoping to find out. And I think that with a new commissioner comes a different culture, comes a different way of thinking. And I think that over the last few years, we've had a lot of issues with turnover and being short-staffed. And so, I'm hoping now that we can make that a priority.
I would think you'd be able to do maybe some cross data comparison with the free and reduced lunch applications through the school to see who might be eligible for SNAP as well. That might be a great place to start.
Well, the other part of it too, for those who have worked with people who have had to go to DSS to get benefits, for those who have had to go to DSS themselves to get benefits, it's not a process that anybody enjoys, right? And so I think that for some people who may need those services or who can benefit, don't want to deal with what that feels like. I remember years ago having to go for childcare assistance, and it was really challenging from start to finish to kind of endure that process. And I don't think things have gotten better for a lot of people. So I think there are people who are eligible, know they're eligible, but don't want to be bothered, or they might be eligible, but by the time they go through everything, they get $25 in stamps, right? Or they find out that they'll get, $10, $20 a month in daycare assistance. So it's a lot to go through depending on what you end up with. So I have to assume there's a better way to do that by utilizing people in the community to help make that happen, at least to get through the first steps and, better understanding the regulations and the expectations from New York State. I think that sometimes people who do that work are stuck between state mandates and trying to help people. And so trying to figure out what's the best way to make that happen.
Any other questions for Travis? Thank you for that presentation, and may you have success in carrying out those goals.
Thank you.
And next up, if I say the name wrong, tell me, Anushka Bargivi. Sorry if I did that wrong. Who is one of those public health fellows who is working with Whole Health, and as part of the community health survey, she has some data results. So Anushka, if you could take that away.
Yes. Thank you, Beth. Yeah, so I am Anushka Bhargave. I'm a public health fellow at Tompkins County Whole Health, and I coordinate the community health assessment and community health improvement process. Let me share my screen here.
Anushka, I'm just gonna mention, the way this presentation is, I would recommend people, I think Anushka will kind of pause on each slide that ask questions as she's going, because you're gonna get a lot of numbers thrown at you. So if you want to dive a little bit more into what she's showing on the screen, please unmute or put a question in the chat.
Yes, thank you. So let me give you all a background about this whole process. We call it Chai Tompkins. So what exactly is Chai Tompkins? Community health improvement process, or Chai Tompkins, is a process that includes the community health assessment and improvement plan, which sets priority goals for Tompkins County. And this round particularly will help inform the health planning during the 2025 to 2030 cycle. As a part of Chai Tompkins, Tompkins County Whole Health recently launched the Community Health Survey in February 2025. I'm sure you must have all seen it, filled it. So yes, this survey was an opportunity for the community to share ideas and perspectives about health in Tompkins County. And this survey and the process was organized by Tompkins County Whole Health along with Cayuga Health and community partners. So the goal of the survey was to collect around 1,200 to 1,500 responses. Well, we achieved over 2,000 responses, at least for people who opened the survey or answered question one, which was, are you a resident of Tompkins County? But around 1,800 people completed the majority of survey, which was great number considering that we were only expecting around 1,200 to 1,500 responses. The demographic representation of the survey was, and I have everything in comparison with the census of Tompkins County just to give you an idea of the representation. So for age, this was the representation. Blue is survey respondents and red is Tompkins County census data. As you can see, we had overrepresentation in the age group 65 and above, and a very low representation in the age group 18 to 24. And then rest of them were at fair representation. As for race, again, it was we had good representation across different races except for the Asian population. The census stands at 10%, but the survey respondents stands at 2%. As for income, again, good representation across different income brackets, except for 25 to 50,000 income bracket and less than 15,000 income bracket a little bit. Then for municipality, again, we had good representation overall. Across different municipalities in Tompkins County. As for gender balance, the survey was skewed heavily towards the female population, with women reported at 70%, men were 23%, and 3% of the survey respondents were non-binary. 48% had a graduate degree and 49% had a bachelor's degree or less when it comes to education. So moving on to the main stuff, the survey results. This was our question one. In your opinion, what are the three most important factors that create a healthy community? So according to Tompkins County, the three most important factors that create a healthy community are affordable healthcare, affordable safe housing, and a clean environment. I'll give this a minute for you to absorb.
Anushka, do you think that the more heavily weighted age of the seniors doing this survey influenced the outcome here of the top three?
Yes, it could be because since the survey was heavily skewed towards 65 and above, the results could influence that population's point of view. So it is one of the limitations of this survey that we would like to acknowledge.
Did you break, could, or could you break the answers down by age group and see if there was a difference?
So yes, we tried doing that, but essentially it followed the same curve.
Thank you.
Thank you. Sorry, there were some comments about. Yes, it was the comparison. Thanks, Nicole, for taking that. Moving on to the next, our second question in the survey was, in the past year, have you or anyone in your household faced difficulties paying for the following? So financial, we had this cross tabs with age and income, and I have graphs for that as well in the appendix. So if there is interest in seeing those graphs, I can share the presentation with you, or if we have time later, we can go visit those graphs. But in the interest of time, I'm just going to summarize that entire thing into financial difficulties are most pronounced among younger adults and lower income individuals, affecting essential expenses such as housing, medical care, utilities, childcare, food, and transportation. And these challenges gradually ease with higher income and older age. Also, there was so every survey question we had an option of prefer not to answer, and some of the respondents did end up choosing that option, but just for easier visual representation of the survey, we chose to take it out, but it's still there. So if you add up the n for each of these, it wouldn't go to 1860 since we have taken out the prefer not to answer from the graphs here. So moving on to the next. Our next question was, in the past year, how often have you felt stress or anxiety about meeting basic needs? And we had this cross-tabbed with income range. So in terms of stress and anxiety about meeting basic needs, it decreases as income rises, with lower income individuals experiencing the highest burden, though a notable portion of those earning between $100,000 to $150,000 still reported occasional stress. Moving on to the next. Our next question was, have you experienced any of the following in past year? The options were feeling of loneliness or isolation, limited social support network, thoughts of self-harm or suicide, or using any of the following more than you would like to, drugs, THC products, alcohol, tobacco, or nicotine products. And there were some pressing concerns, such as these were most prevalent among younger individuals with high levels of loneliness, limited social support, increased use of substances, and suicide ideation. While these issues decline with age, loneliness and social support challenges still persist among older adults.
Anushka, are these results what you expected? Because we hear a lot about elders and social isolation, and it looks like the youngest age group is feeling that more than the older population.
Yeah, that was surprising actually. So, yeah, we do hear this issue that older people are somehow lonely, but the survey does not reflect that. And considering that our survey has a lot of representation from the older population, I don't know. Maybe the idea of loneliness is different for the older population, or they might not consider being alone as loneliness. I don't know.
I wanted to add, I know in some recent meetings, we've talked about this issue, especially with the younger generation. I mean, certainly in the last 5 years, we know the COVID implications and how people are isolated, especially those that are younger, but also there's been like a shift in generations because people are like interacting so much more online that they're not necessarily getting out and engaging as much. And that's, I think, represented in this graph.
Yes, that's a good one. Thank you.
I would agree with that. That's from information I've seen and read about and learned about that it is it's really not true that the elder generation is topping the loneliness epidemic. It's also potentially, though we don't have that in front of us, that the 65 plus is also the highest income. And so that also may have something to do with it.
Moving on to the next. Our next question was, in the past year, have you engaged with any resources in the community to meet your basic needs or improve your mental health? A significant portion of respondents engaged with community resources to address their needs, with most finding at least some benefit. However, a notable number either did not find the resources helpful or chose not to engage despite knowing about them. Additionally, a considerable share of individuals reported having no needs of requiring such support. I would like to also add that we are trying to cross-tab this particular question with the previous one, where it was asking, have you experienced any of the following, that like loneliness, social support? So far we have found out that 44% of the people who reported having those issues, feelings of loneliness, social support, suicide ideation, did use the resources at their disposal, and that addressed at least some of their needs. So the number is 44%. Moving on to the next. Our next question was, how would you rate the safety of your neighborhood? We had this cross-tabbed with municipality. So across municipality, most individuals feel safe, though a notable percentage reports feeling somewhat safe, indicate lingering concerns or occasional risks. The small number of respondents feeling not very safe or not safe at all further highlights that safety concerns, while limited, still exist for some residents. Moving on to the next one. Our next question was, do you feel there are enough recreational spaces for physical activity in your community? We again have this broken down by municipality. So while most municipalities report having sufficient recreational spaces, a notable percentages of respondents also feel that these spaces are lacking. The no response across multiple municipalities highlight that access to recreational areas is a concern for a significant portion of the residents. Yes, I will, Shasta. So Shasta had a request. She wanted me to go back. I think it is not- Awesome. So here it is broken down by municipality for recreational spaces. Moving on to the next. Our next question was, for each service, please indicate what barriers you have experienced in the past year in accessing these services. The services that we were particularly looking at were dental care, preventative care for your children, primary medical care, prenatal care, mental health care, substance abuse treatment, and cancer screening. So among these services assessed, dental, primary medical care, and mental health care face the most access barriers, especially due to cost, provider availability, of in-coverage network, and longer wait times.
Anushka, obviously, it looks like there is a significant, and we all know this, issue with dental care. Are there plans, going forward to try to address that issue or make that one of the priority goals?
So, during the last Board of Health meeting, the council did pass a motion to form an oral health steering committee. And so there's another fellow called Sagarika. She is working on oral health projects. And I know Dr. William Klepak, the medical director of Tompkins County, he is also heavily involved in this. So hopefully we'll see some good changes.
Thank you.
Thank you. Moving on to the next. This is our last question. How would you rate the quality of health and wellness resources available in your school district? We have this broken down by municipality again. So, perceptions of the quality of school based health and wellness resources vary across municipalities, with relatively few residents rating them as excellent or very good. Most respondents describe them as good or fair, while some municipalities, particularly Danby and Groton, have a higher percentage rating them as poor. So, yes, this is all I had. These were all the questions and these were the results. Please let me know if you have any questions. I could also share the presentation if there's interest in seeing the results again, going in detail, or I also have the cross tabulations for some of the graphs I didn't show in the main presentation down in the appendix. So if there's interest, I am more than willing to share it with you all. Thank you.
Thank you. Very, very nice presentation and kind of eye-opening in some areas. And just to clarify, this ties into then the goals that you're setting for the next 5 years. Okay. Anybody have any more questions?
I was just going to mention, I'll send the presentation with the minutes, so you guys will all have access to that.
Thank you.
Beth, I have
Go ahead,
I have a
Bill.
question.
Sure.
Is it possible to break it, the security, people's feeling, how secure they felt? Is it possible to do an age breakdown on that? Is that something you did a crosstab on?
So we did do a crosstab with that. It did not show us, it did not give a lot of information basically. So we chose to keep it with municipality only.
Okay, thanks.
But I do want to point this out that the older population relatively felt safer than the younger population, but it was a small difference, not significant.
Okay.
Thank you.
Any further questions? I'm laughing. I'm sitting here looking at Daryl's portrait, and that hamburger is driving me crazy. Nothing else on the agenda unless somebody has something to add. The next meeting will be May 12th. It will be an in-person location to be determined. Anything else, Nicole?
No, give you guys back about 20 minutes in your day.
Thank you all for attending and have a great day. The sun's even out a little bit. Bye-bye.
Thank you. Bye.